Section 27 of the South African Constitution speaks of access to healthcare as a fundamental right, but private healthcare prices have been deemed so high, preventing many from accessing their fundamental right. The healthcare market inquiry seeks to understand the drivers of the sector's inflation, which always tends to be a measure ahead of average consumer price inflation. The inquiry will be listening to the insights of consumers and labour on the 26th of February.
The idea is for the consumer groups to talk to us about their experience with other stakeholders in the private healthcare sector. Whether it's negative or positive, it doesn't matter.
Service providers like hospitals will have their public hearings on the 27th of February. Some stakeholders have expressed concern that the public hearings may be combative in nature, with the worry that they will serve to bash healthcare service providers. But Justice Ngcobo was at pains to stress that that would not be the case.
This is not litigation where we will spend days having stakeholders being cross-examined. This is an inquiry which is being conducted by the panel, which seeks information which is relevant in order to answer the statutory questions posed. As a chairperson, I will assess the need for any questions to be put, and I will deal with the cases on a case-by-case basis.
The hearings will be the last leg of the inquiry, which has been set the target of the 15th of December this year to conclude its work. The public hearings will assist the market inquiry to hear from all the relevant stakeholders dealing in the private healthcare system. Once it's amassed all its information, dissected it and made its conclusions, it will then submit recommendations to the Competition Commission, who in turn will submit those recommendations to the Minister of Economic Development. Justice Ngcobo emphasised that the panel's job was to ultimately provide recommendations to halt uncompetitive practices. Once in the ministry's hand, the inquiry would have no influence over how those recommendations were actioned. Nompumelelo Siziba, SABC News, Johannesburg.